Great, let's get started. For those who are on time, I don't want to hold them up. Good afternoon, everyone. Welcome to our uh, Municipal Health Insurance Consortium's educational series as we continue. I think this is our fourth webinar, and today we're going to focus on the plan selection framework. I'm Elin Dowd, our executive director, and I'm going to cover the slides today. And the way we'll go about this is if you have a question, please put the question in the chat. Kylie is going to manage the chats for me and then interrupt me at an appropriate time. After the webinar today, we will be sending out the slides. So there are some links within the slides that will take you to the information we're covering today. And then in the long run, we post the webinar on the website.
Yesterday was first 316.
So with that said, let's get started. When we're thinking about the consortium, we, the staff and we, the collective, know that our strength is not in any single member, but in our commitment to stand together. Sharing risk, responsibilities, yes, we are recording. Sharing risks and responsibilities and the path forward. And that is what this presentation is all about. Shared risk and our responsibility within a shared risk environment. So anytime we look at policies and procedures or any decision the executive committee and the board are making, we are thinking about realizing our mission. So today, in order to talk about how we can be mission-centric and some of the things that are central to our mission, I'm going to cover two areas. The first area is to talk just a little bit about our municipal cooperative agreement. And then the second is updates to our plan management policy. This policy has gone through several different naming adventures, but we are now landing on the plan management policy. So there's some resolutions that have been put into this that have been passed, put in the past. Then we had the plan parameters, options, participant policy, which was way too much to say. So we've combined that all and added some new things into the plan management policy. So as I said, we always want to make decisions that are centric to our mission being an efficient intermunicipal cooperative provides high quality, cost stable health insurance for our members and their employees and retirees. How do we do this? We do this by supporting our municipal members and their employees, but really by promoting long-term sustainability of the entire organization. Now, before I slip away from this slide, I wanted to point out that that is our headquarters. It's the architectural rendering, but it looks very similar to the actual building that was built. So for those of you who haven't been to our headquarters, please stop by. Make sure you call in advance though, because we're not always here. A lot of times we're out visiting you or doing other presentations elsewhere. That corner office right there is where I'm speaking from right now, looking out on this beautiful spring day. Mind over matter. It is spring, right? So please come and visit us at 408 East Upland. So let's focus first on our municipal cooperative agreement. The municipal cooperative agreement is more than a document. It is our collective promise to act in the best interest of the whole, not just the individual. Once again, talking about the long-term sustainability of the whole. I hope that's not my car alarm that just went off. Um, Always happens when you're doing something on Zoom. Why does our MCA matter? First of all, it defines our governance structure. It establishes the shared risk and responsibilities of the collective whole. It ensures consistency across all our members, and it is the foundation of the trust and collaboration that this model was built on. It guides our decision-making process. It protects our financial integrity, and it aligns members under common rules. It supports our long-term stability. Please review your MCA each year. We ask you to sign it every year whenever there's a change, because we add new members every year. There's almost always a change to the MCA. But we ask you to refresh your memory on what is actually in the municipal cooperative agreement and what you as a municipal member have agreed to as part of this collaboration. So before you put questions in the chat, our 2026 MCA with changes that were approved last year at our board meeting are still sitting with DFS. I do have a meeting with them next week to see if we can have a more efficient model to get new MCAs out to you for approval. I know a lot of you keep putting this on your agenda and keep moving it forward once you get in touch with me. When we add the new members, they sign kind of the old MCA with no changes, so we get a commitment from new members. But once the whole document has been updated and approved, we're not just asking you, the voting member, to sign it. Your whole municipality, which is a part of this shared service, needs to form a resolution and vote on the changes that were made. So one of the things in our municipal cooperative agreement that we're going to talk about in a minute is it says if you are going to join us, you must bring all your active employees. So that comes straight from the municipal cooperative agreement and will be an example that I talk about later. Each year, when we start looking at plan changes, updates to the municipal cooperative agreement, the staff, our consultants, we work with our executive committee to establish these strategic objectives, to remain aligned with our mission and vision, to be focused on our priorities for the organization, resource allocation to remain proactive and not reactive, and to make sure that our shared vision is for the sustainability and success of our whole organization. We just updated our strategic objectives for a 3-year period. We did that for this year. It was approved at the executive committee level. Here's our 5 objectives. We're looking at financial management, claims analysis and cost containment, strategic partnerships, organizational sustainability, membership growth, membership engagement, governance and administrative policy development, and advocacy and regulatory reform. So in the first quarter, we have been focusing on advancing some of those strategic initiatives. The first one we've been working on to optimize our revenue flow and payment options. You should have received several emails from Jen our finance manager about paying us by ACH or electronic payments. Um, that is the most efficient way for us to run our organization. We have found it really hard to rely on the United States Postal Service, as I'm sure many of you have noticed in your personal life. It's not quite as efficient as it used to be. Several delays, mail returned. We're feeling those pains here at the office. The other thing we have done is we have closed our PO box. It was an efficient way for us to run. We now have mail coming directly to our 408 Upland building. So please change our PO box if you haven't done so, and please pay us by ACH. It really is it's an efficient way for your business as well as for us. The other thing we are doing, and we are not ready to talk about the details today, but please know that we have been spending a lot of time on 3 and 4 tier premium modeling. We are looking for the best way to create this plan as well as implement this plan and transition to a plan like this, should that be the direction the consortium decides to head. So I'm not going to cover that today, but yes, we are working on that. And through the committee process, there are going to be a lot of updates given over the next couple months so we can look at this more at the board meeting. So today we're going to talk about the plan management policy, and that's this third bullet point, implementing an administrative fee policy or a plan parameters, guardrails for plan customization. And we'll talk about more about that. We also want to work on strengthening our data analytics. We're working with our third-party administrator on that. We want to make sure we're retaining our existing members by reaching out to you, speaking with you, coming by and visiting you, providing extra customer service for you. And we're also in the process of recruiting new members, which is what I'm spending a lot of time on this time of year. And we want to strengthen our relationships with associations. For any of you that might be in Canandaigua next week on Monday and Tuesday, the consortium will be tabling for the Association of Towns educational sessions. So please swing by and say hi if you're going to be there. And I'm hoping to be engaging with some potential new members while I'm there. The other thing, objective that we've been working on, and you can see as evidenced by the agenda today, is more educational sessions with our existing members. And we want to keep hearing from you on what information you need to help you make better choices or how we can better serve you through educational sessions. So please provide feedback. We're really looking for that. So first up, we'll talk a little bit about our plan management policy. When we were looking at this and looking at guardrails, we wanted to review our current plan movement trends. We have had a lot more movement in the last 2 or 3 years than we have previously. So we wanted to look at where people were moving from and to, and how that was affecting us as a whole, because we wanted to focus on sustainability. And we wanted to evaluate the need for guardrails, and we wanted to balance your flexibility with some control at the consortium level. So we designed the plan management policy, and we built it with staff input, consultant input, committee input, and a lot of executive committee input. So why create this new policy? Because when individual choices shift risk disproportionately, the entire system absorbs the impact, reminding us that sustainability depends on balance. So I'll give you an example of when we're talking about balance. A municipality may have offered two plans in the past, and everybody who was healthy was in the bronze plan, and 90% of participants were in the bronze plan. But that community started aging and moving into an older age group where they felt they had more healthcare needs and wanted a different plan that kind of reflected the moving population. And the platinum plan was available to them, and people started moving from the bronze plan to the platinum plan. So as you know, the platinum plan is a richer benefit. The bronze plan covers basically 60% of costs. The platinum plan covers 90% of costs. So we had been collecting premiums on a 60% coverage option, and now everybody's jumping to a 90% coverage option. And that creates unbalance or an imbalance within the consortium. So we have to look at the whole system. The thing we're most concerned about is adverse selection. So adverse selection in the example I gave you is overall when higher risk individuals select richer plans, and that leads to increased claims cost. And it destabilizes our premium structure. So we want to manage adverse selection. And one way to do that is by putting guardrails on plan movement, by encouraging balanced enrollment and monitoring utilization trends. And aligning plan offerings with organizational objectives. So we had to articulate some of these things within our policy. And although our requirements around plan selection hasn't really changed that much, we have articulated it in more detail so municipalities understand when they're making changes where we'd like you to land. So the first part, we're talking here just about actives. So if you're a member municipality with 50 or less subscribers, we are asking you to pick one plan. Unless you are required to offer another plan due to a bargaining unit or a collective agreement, and you have a waiver in place. And or if you are transitioning to a new plan. So you've been on one of our legacy plans forever. You're now moving everybody to the platinum plan, but you can't do it all in 1 year. You have a plan in place to transition. So you may have two plans in place for a period of time that would be included in your waiver approval. If you're above 50 subscribers, we'd still love you in one plan, but you can select more plans the larger your municipality. And if you're selecting one or more plans, that would be one of the metal level plans that would be an option for you. We'd like your municipality to be in two plans for all active employees or non-Medicare aged retirees. So if you're retired and you're Medicare eligible, the municipality has three options. Your retirees can remain with your actives. And you're underage, under Medicare, remain with your actives, but you can also have your Medicare eligible remain with your actives. They could continue there. You can offer a Medicare supplement plan through the consortium as the plan for your retirees, or your retirees may select a Medicare Advantage plan, We have found we are not competitive. We're not able to provide a Medicare Advantage plan due to how we are organized. But on the open market, there are some Medicare Advantage plans that are available to you. And if you elect to remove all your retirees and go to that Medicare Advantage plan, you can offer that as well. But if you provide a choice, hey, stay with the consortium in the Medicare supplement plan or go out to a Medicare Advantage plan, the retiree cannot come back. That's adverse selection. They make that decision, it's a binding decision. They cannot come back at a later date into the consortium. So let's talk about if you are Medicare eligible, you're a retiree that's Medicare eligible. There are some rules for Medicare eligible individuals, and you have to sign up for a single plan under Medicare. So you and your dependents might have to split plans if um, not might, you will. You and your dependents will have to split plans. If you are the only person covered under Medicare, sorry, if you're the only one covered under Medicare, you can move to Medicare and your dependents will remain in the current active plan with the employer as a single. So you're both single now. If if you're both Medicare eligible, you're on a Medicare plan both as singles, or you're on what is offered by your municipality as a single. There is no other split coverage. If you are under Medicare age, you are covered with your employer. You are not eligible to split coverage unless you're both employees of that organization. But you cannot have a dependent under single coverage that is not an employee of the organization. So only under Medicare are contracts split. So what if you can't comply with the plan selection process that we have just rolled out? There is a solution. It's not end of discussion. It continues a discussion. We have a waiver process. We put more detail into the waiver process in the plan management policy. So if you need flexibility due to current bargaining unit contracts or competitive options, you can request a waiver for non-participation in consortium metal level plans for a specific bargaining unit. For example, if you were a new member and you came to us and you had an old contract in place with a collective bargaining unit that was in another plan and you couldn't bring them in within the first year because that agreement is not up for another 2 years, you can have a waiver to hold off and bring them all in at a later date. Because as I said, back to the MCA, um, it's not some, it's all that joins the consortium. So if you are requesting a waiver, you're going into a bargaining situation, things are a little bit different next year, or you can't move everybody into a plan next year. So now you're offering 3 plans. You know, we want to get you down to 2 plans, or if you're in a 1 plan option and you're moving up to 2 plans through a transition period, I want to articulate the waiver process for you. We want to start a dialogue with you as soon as possible. We start building our budget in July. If there is planned movement We want to know about it as soon as possible, and we want to build it into the budget. So let us know what you're thinking. It may not be in ink. It may not be finalized. It may not be finalized till next year. Let us know so we can start building that into the budget, but also so we can start talking to you. Have you considered this? Have you thought about X, Y, and Z as you go through this plan changes? Do you want us to do plan comparisons for you? Do you want us to come out and do open enrollment for you? All of those things, are part of our planning process, and we'd like to start chatting with you about it in July. As we have that conversation and things develop and for sure you need a waiver, we want to know about that waiver no later than September 1st. In September, we finalize our budget for the following year. So if you're thinking of making a change January 1, we want to know about it September 1st. There's another thing that I don't really want to bring up, but I think it's a necessity to bring up. In our municipal cooperative agreement, there is a withdrawal process. Not many people read that. We haven't had only but two municipalities ever leave us. But if you are considering, hey, we want to shop the market, um, let us know. We'll walk you through the withdrawal process. We think it still behooves you to stay with the consortium, but there are ramifications, including financial ramifications to your municipality. And so you must notify us by September 1st as part of the municipal cooperative agreement. So these waivers fit in on any planned movement, regardless of whether you're staying with the consortium or if you're leaving the consortium. We need to know that as part of our budgeting process, and we need time to process all of these changes. So September 1st is very beneficial in helping us. There is a formal documentation process to go through, requiring resolutions, requiring forms from the consortium. And it has the forms provide a clear implementation plan, a time frame for completion, so the consortium knows what's going on. Typically, waivers are granted for a period of 3 years. So I kind of covered this a little bit. What are conditions for a waiver? So within that waiver, we want all fully enrolled, um, all active employees fully enrolled in the consortium plan options. And then the other waiver is if at the end of a 3-year waiver period that the consortium remains non-competitive with your current collectively bargained agreement, outside agreement. We want to go through that with you, do a plan comparison with you, verify that that waiver should remain in place. So other changes during the open enrollment and budget process. So we talked about, I lumped this in earlier, that if you are making those plan changes, same thing, July 1st for plan changes, which is the same as the waiver date. Let's start the conversation. Anything effective January 1. Any other time of the year, we need a 90-day implementation plan. So the sooner you can talk about it, the better. Most people don't change plans during the year. And then the other is the new plan addition form that we can provide you with. Okay. We've covered most of this already, that within the municipal cooperative agreement, participation by some, but not all, is part of the municipal cooperative agreement, does require a waiver. And we will honor collective bargaining agreements and issue a waiver for that reason. So some other new things that have come up is one thing that has been in resolutions is now in the policy. When you make a plan change, we are asking that you stick in that plan for 3 years. That creates that balance for us. It helps us eliminate that adverse selection. It gives us that long-term rate stability and minimalizes our risk. When you are making a change, we have now put in a surcharge if you are moving from a richer plan to a less rich plan. So we'll talk about that a little bit. This is brand new. This is a surcharge. So if you're switching from a rich benefit, like I said, the platinum plan to a bronze plan earlier, or the reverse is not a surcharge. So going from a bronze to platinum, but if you're going from a platinum plan to a bronze plan, or you're going from a platinum plan to a silver plan, if you're jumping down tiers, 1 tier, no surcharge, 2 tiers, surcharge, 3 tiers, surcharge. So the surcharge in the first year is a blended annual premium. We want to make sure we are covering the remaining claims liability. We still know your claims, even though you're changing to a new plan, your claims are still the same. You may be covering a little bit more of them in a deductible, but we know as a consortium, we are still responsible for those claims. We have runoff. We're paying claims at a higher level and you switch to a lower premium. When we look at setting our premiums, we're looking over the long run. We're not just looking at 1 year. So this helps us create that long-term stability. So in runout, your new surcharge premium rate will be 3 months at the prior plan's new premium rate. So if you were at platinum, it would be at 3 months at the platinum rate and then 9 months at the new plan rate. This allows you to still save money in year 1 of implementation, but it still allows the consortium a little cushion to pay your run out from a much richer plan. So we take that 3 months plus 9 months, we add it together and we divide it by 12 just to make it easy for you. So you're paying that over a 12-month period. You have one rate for the year, regardless of new people dropping off. You have that one premium combined rate for the new year. So if you want to see an example of that, it is an addendum in the plan policy, and there is a link to it in the slides, so you can go back and look at it and digest it. So in 2026, if at the end of 25 you said the beginning of 26, we want to switch from the platinum plan to the silver plan, we would charge you the 26 premium platinum rate. So the family rate at 2,900, the individual 1,000. We would multiply that by 3 months. And then we would take the silver rate and multiply that by 9 months. We'd add those two together. We come up with a blended rate. We divide by 12, and that is your new silver rate with that surcharge added onto it. And that's what you would be billed for the first year only. This gives our plan the opportunity to adjust. to all that plan movement. So in summary, on the plan management policy, we're asking a couple things. We're asking for more notice. Tell us in July what you're thinking. Let us adjust. If you're going into any negotiations, let us know. We're here to help you throughout your negotiations and keep the consortium informed. We've got new deadlines, new submission notices. We've reduced the time frame if you are transitioning from 2 plans down to 1 plan, or you're transitioning from multiple plans down to 2 plans. That used to be a 5-year transition period. We're asking you to move it to a 3-year period. We now have the mandatory movement surcharge that I just spoke about in addendum A of the plan management policy. We've articulated more what the waiver process and the waiver timeline is. We strengthened some of those rules. And we've also put in the termination rule. If you are a retiree or your covered dependent elects to terminate coverage under the consortium, you are not allowed to return back into a consortium plan. That's the definition of adverse selection right there. So we didn't create this in a vacuum. We were very considerate of our current members. We had a working group of active members looking at this and how it would impact their municipality. The executive committee cussed and discussed it several different times. We also wanted to make sure it didn't restrict us so much that it deterred growth in the future. We wanted to make sure we could enforce it and administrate it effectively and efficiently. And we wanted to make sure that you at the local level still had control and flexibility within our policy and the ability to collectively bargain. So what's the next steps? Just letting you know, this policy has been approved by the executive committee that acts when the board is not in session. We are rolling it out now so it can be effective during our open enrollment process and while people are making decisions for 2027. It's not an end-all be-all. The board will ratify it in September, but we want to implement this and we want to analyze. We want to make sure this is working for everybody, for the collective whole. So it's a living document. It's going to be refined. It's going to be, changes are going to be made as we hear more feedback from our members, as we administrate it and make sure we can administrate it. We want to make sure we're communicating with you, we're engaging with our members throughout the process. So please engage with us and give us your feedback, give us your direction. And we want to make sure this is aligned with our financial strategy so we can become a more secure and rate stable organization. I will say this slide here, I think is very intimidating because when we are looking at strategic initiatives, sometimes the steps look like this, that we have a long way to go. But we're going through this process together and it looks like a really fun place to be walking up these stairs. I'm sure there's a rainbow on the other side or some really fun and interesting activity to do, even though those stairs look really intimidating. So going back to our mission where we started, which is rate stability. So rate stability, it's not accidental. It is the result of intentional decisions, shared sacrifice, and a commitment to the long-term health of the entire consortium, not just year to year, but the long-term health of this organization. I'll pause there just to see if there's any questions coming into our chat.
Haven't
Looking
seen any yet.
Okay, great. All right. So in closing, as I said, we are giving you links when we send out the slides. If you registered today, the links are to our municipal cooperative agreement and the consortium plan management policy. And the third resource, that's your employer page where all the information regarding your municipality is located. So these are live links once you get your slides. Please, use our website whenever you need to. These are just reference points for you going forward. I also want to remind you of some upcoming dates. If you don't have our board meetings on your calendar, everybody's welcome to our board meetings. August 27th is when we are going to be talking about our plans, our budgets, our premiums, our officers, all changes that are going to become in front of the directors on September 24th. When we have our annual in-person meeting with directors to vote on all those changes. We are currently looking at 2 different locations for that meeting. We'll share more information on that as we look at those venues. Next month, for any of you who don't come to our joint committee meeting, we always look at the previous year's utilization. Everybody's saying, what's going on with the cost of healthcare? And our utilization review gives us a great way to analyze where claims trends are happening. So I'll, steal some of the thunder. Our outpatient procedures have really upticked in pricing. Our pharmaceuticals have upticked in pricing. Musculoskeletal has upticked in pricing. Those are the things we're looking at. Those are the trends we're looking at as we look forward in any budget requirements as we start building that throughout the year. So that's a really interesting meeting. And it is online. You don't have to come in person. We will have Excelis present to walk us through that claims analysis. I now call it the annual insights meeting because we do garner a lot of insight to our claims trending. And then our next educational session, I guess this is session 3 because the next one is session 4. If you're going to attend any of these webinars, I say you attend the Medicare 101. Even if you're 21 years old, giving advice to your retirees, family members, this is the class for you to attend. Kylie really explains Medicare in layman's terms, so we know when we reach that, when we reach that age what is required of us, and we can guide our employees through that process as well. So I paused earlier. I'll pause again for questions. And the question period doesn't have to end here. I've also provided my phone number, my email. I'm accessible to you as well as the rest of the consortium team. If you pull the policy up, you start reading it, it doesn't make sense to you, give us a call. Let us know what your questions are before that time frame rolls around where you have to make decisions. Please feel free to connect with us. That's what we're here for. We're here to help.
Oh, thank you.
Thank you. Thanks for participating today. Appreciate all of you spending time with us this afternoon, and we will look forward to seeing you soon, one way or another.